Hi friends, welcome back to our YouTube channel, one and only pharmacy. So friends, in this video we see detailed notes about chapter Posology, subject Pharmaceutics second, D Pharmacy second year. So friends, I request to all, please watch this video till the end. Let's start. Posology. What is posology? Definition of posology. It is the branch of medical science. Posology is the branch of medical science which deals with the study of dosage of drugs required to produce a specific pharmacological action. Let's see once again and remaining or note down in your notebooks. Definition of posology. It is the branch of medical science which deals with the study of dosage of drugs required to produce a specific pharmacological action. These are the very simple definition of posology. Posos means how much and logos means science. It is the Latin words, Greek words. Let's see next. Dose. Definition of dose. The dose is defined as a quantity of drug which is enough to produce a pharmacological action. The dose is defined as a quantity of drug which is enough to produce a pharmacological action. Next, factors affecting dose and action of drug. There are 15 factors affecting dose and action of drug. List see in list here: age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor or environmental factor. Next, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, dependence, and tachyphylaxis. These are the 15 factors affecting dose and action of drug. Let's see once again. First, age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, route of elimination, synergism, antagonism, dependence, tachyphylaxis. These are the factors. Let's see one by one in details. How age is affect the dose and drug action. Generally, children and old people acquire small doses of drug than adults. It's very basically children having small dose. Generally, children and old people require small dose drugs than adults. Age is concerned with the capacity of metabolizing and excreting the drugs from the body. Next factor, body weight. Heavyweight persons requires large dose than normal body weight persons. Usually 17 kg is considered as a normal weight of adult for calculating doses. According to weight, the dose of drug varies. Third factor, sex. Female adults generally require small doses than males due to presence of more fats. Fourth factor, route of administration. Rate of absorption depends upon route of administration, thus dose differs according to route. For example, IV dose requires small dose, intramuscular dose then higher than IV dose, then subcutaneous dose, and then oral dose. Oral dose requires high dose because of degradation of drugs. Fifth, time of administration. If the drugs are taken on empty stomach, then absorption of drug is greater but GIT irritation may occur. If the drugs are taken after meals, that is full stomach, absorption is lesser but no GIT irritation. Sixth factor, presence of disease. In diarrhea condition, absorption of certain drug is lesser. Presence of disease may affect the absorption of drug. Seventh factor, genetic factor. Deficiency of certain enzymes may produce hereditary disorders. For example, diabetes mellitus. Drug allergies are also heritable. For example, sulfa allergy and penicillin allergy. Eighth factor, environmental factors. The doses required to produce the actions during day and night may differ due to some psychological changes. Psychological, not physiological changes in body functions. For example, dose of phenobarbital, that is, these are the drugs of barbiturate, required to produce sleep during daytime is higher than dose required to produce sleep at night. Ninth factor, acquired tolerance. What is tolerance? It means a large quantity of drug is required to order to obtain a desired effect on a drug. For example, morphine, heroin produce tolerance. Tenth factor, idiosyncrasy. It is an abnormal or unusual response given by a drug. For example, in some persons, morphine causes asthma, or generally these are called adverse drug reaction. Rate of elimination or cumulation. Cumulation means accumulation of drug in the body due to slow excretion, causing toxicity. For example, digitalis, chloramphenicol. Synergism. The simultaneous administration of two or more drugs may result in increase of action. The phenomenon is known as synergism. For example, aspirin and caffeine as analgesics. Antagonism. The opposite action of two drugs on the same physiological system is called antagonism. For example, morphine and naloxone. 14th factor, tachyphylaxis. Repeated administration of drug within short intervals of time decreases pharmacological response progressively. This is known as tachyphylaxis. Example, ephedrine in the treatment of tachyphylaxis. Formulas for calculating doses in children. There are two formulas. First, Young's formula. What's Young's formula? Child dose equal to age in years upon age in years plus 12 into adult dose. These are the calculating dose in children by Young's formula. And second, Fright's formula. Infant dose equal to age in months upon 150 into adult dose. These are the dose calculating formula by Fright's formula. So friends, in today's video we see a definition of posology and dose or their Greek meanings and factors affecting posology. Let's see once again in quick revise. Posology, a definition, it is the branch of medical science which deals with the study of doses of drugs required to produce a specific pharmacological action. Posos means how much, logos means science. Dose, the dose is defined as a quantity of drug which is enough to produce a pharmacological action. Factors affecting dose and action of drug, there are 15 factors which are age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, dependence, and tachyphylaxis. We see once by one all: age, body, sex, route of administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, tachyphylaxis. Formulas for calculating doses in children, there are only two formulas: Young's formula and White's formula. Thank you guys for watching this video till the end. So friends, if you're new on the channel, so please do like, share and subscribe, because this channel is especially for pharma students and specifically in D pharma students first year and second year. This channel includes MCQ basis test or detailed notes. Thank you guys, and let's see meets in next video.